everyone, welcome back. My name is Chelsea, as you can see, as you know from the last sessions. Today we're going to continue developing your skill related to the pathology collections and helping you to do your job in the future. So today's section we're going to cover, which is going to collect specimen other than blood. During today's session, we're going to demonstrate how you're understanding the knowledge and how you're going to collect the specimen other than blood. Which means we're going to divide today's sessions into two sessions. One is purely going to telling about the method of collecting those specimen other than blood. And the second, I'm going to demonstrating how we are going to demonstrating those knowledge and implement it into your skills. So first of all, I just need you to follow with the instruction. If you got your phone or your laptop, if you have your laptop, that's good. Just go to Mentic account, enter the Discord, or you can use your phone, scan this QR code. And if you're all ready to go, give this little button, give a little thumb up, and then we will continue to next. Good. Already we see one person is all ready to go. Good. Everyone ready?
Give me 10 seconds.
That's okay. Today we're going to do a skill demonstration. So if you have any questions, please leave the note or send me the email, then I will answer to you if I can answer you during the class, because it probably a little bit condensed time, because we're going to have lots of things going to cover today. Right, good. So okay. So by the end of the section, you will be able to know, confirm the collection requirements, preparing the collection procedure, and collecting specimen, also the follow post-collection procedures. This is going to cover for today's sessions. First of all, if you can see, we follow, we're going to do a little recap regarding the body system that we delivered last week. Can everybody just write down your answer by typing into the little box that's shown on your screen? So tell me how many chambers that we have in the heart. Can anyone still do a little? Perfect. Perfect. Okay. So it means like we demonstrated how to understanding the knowledge of the body systems. That's why we be able to continue to develop your knowledge, because for the entire course, I'm going to let you know, this is going to just building the building, just one floor by one floor. By the end of the session, you will have more knowledge that you need for your work, and also the skill you need for the job. So the purpose of today's sessions is going to teach you how to collect the specimen other than blood. But you probably will know, why do we need to collect the specimen other than blood? Because the specimen, the blood specimen can telling a lot of things, but those specimens, some specimens still require to aid for the diagnosis, to guide the treatment, to monitoring the therapeutic level of the drugs, monitoring the progress of the patients, and also planning interventions. Because as we know from the other session, we learned from the previous from other educators, the specimens such as they will infect your liver, will infect other area of your organs. So by understanding, by collecting a lot of the different specimens, we'll be able to demonstrate and make a right diagnosis to provide interventions for the patients. So this is very important. They can compare all the results from a different type of specimen, and that's why we need to know how to collect the specimen correctly, but not just only blood, but also other specimens. So the principle will follow collection specimen. So the specimen should be collected without contamination, especially if you're collecting any bacterial examinations. And you need to accompany with the appropriate form, which is referral that was given by a doctor. But the form need to have the right type of specimen, which is we're going to teach you about this, and also about the right information of the patient. So when you are collecting, say, patient drop off the specimen for his wife. So patient coming and show you the ID, that is the patient's wife or patient's husband, or himself. If a patient say, my wife tell me to drop off this specimen. And I said, oh, who are you? And then he showed, oh, this is me. And look, oh, this ID is not you. So whose specimen is? So it's very important you always make sure the specimen coming with the right form and with the right ID. And also you follow with the correct procedure to collecting those specimens and sign it off. So there's a lots of type of specimen. You maybe will see this specimen probably 90% of your life working as a phlebotomist or pathology collectors, which is urine fecal. We're going to teach you about how to collect urine and fecal specimen. Don't be scared, okay? And there's one type of specimen you probably will come across quite often if you're working on the side with the laboratory on site, which is semen. Okay, so semen could be a little bit interesting, what we call an interesting instruction that you need to verbally provide these instructions. So we were going to deliver more during the entire sections, and I'm going to just to give you a little bit heads up. So during today's skill demonstration, I'm going to delegate it. This is the instruction you're going to provide it to the patient, and from those type of specimen that we introduce. So just be aware, some people maybe we're going to have to provide the instruction to the patient regarding collecting the semen sample, okay? Right, so the next one, let's start from the urine specimen. What's the urine specimen? Why do we need to collect this? The definition of the urine specimen collection is the process of obtaining the urine sample from a patient. And the purpose of that, because they can give you the clinical definition of therapeutic interventions. Okay, so what's the indications for the urine analysis? Okay, that's the most likely, most of the students who's female will be, if you're pregnant in the past, you need to do a urine. When you feel like, oh, you're not quite sure whether you're pregnant or not, so pregnancy test. And a routine medical check. So if you go to see, every single year you go to see your GP, I'm just going to do a regular checkup. Most likely the doctor will come across, oh, just do a urine and also blood. So they're always coming together. And also renal failure and the diabetes. So we mentioned this from the previous sessions. And sexually transmitted disease. So the procedure will involve wash your hand, and you're going to prepare the equipment you need for the collection, and also providing instructions to the patients for if they need to be self-collect. So the first procedure, of course, when you receive those specimens, they will come in with something like this bag, with the specimen inside, okay? So when you handle this, you have to just be mindful. Some of them maybe you don't want to just touch your bare hand, right? Because they maybe it's a poop, and sometimes they're collecting, maybe they just popping and not even wash their hands. So you definitely want to wash your hand, put gloves in before you handle this. And we're going to teach you how to collecting those procedures in more details. Continuing. So first of all, you need to wash your hand and put on gloves and goggles if required. Some of the specimen may be splashed, okay? So especially urine. So when you put in the urine from one to another specimen jar, it's most likely maybe you would just you don't want to spitting on your face. So sometimes you need to put the goggles on and also place the buoy just to make it easier to do the clean afterwards. And also, once you've done those things and done all the procedure, you just need to make sure the ID is correct. 3 points of ID, that is something we come across to talk about all the time. What's the 3 points of ID, if any nurses here? Yeah? So it's name, date of birth, and Medicare. So sometimes we can accept 3 points of ID, not just the, okay. This one. So 10 minutes, right?